Welcome to Salisbury University on the Air, a program highlighting the people and activities of the campus. I'm your host, Jason Rhodes. This is a unique time in the history of SU, as we face the same challenges as many other universities that have moved instruction online to help slow the spread of COVID-19. With the world affected by the pandemic, the role of the SU community has moved beyond education, with many using their unique skill sets to help battle the virus and some of the issues it continues to cause locally and globally. Faculty, staff, students, and alumni are all pitching in at this time. Here to discuss the ways SU faculty are making a difference is Dr. Karen Olmstead, SU Provost and Senior Vice President of Academic Affairs. Karen, as we observe social distancing and hold our first SU on the Air in a virtual setting, thank you for joining us.
Thank you, Jason. I'm glad to be here.
For faculty, one of the first questions that came to light was how to continue to educate students who are in the middle of their spring semester. What kind of steps have faculty taken to do that?
Well, although we have many online programs here at SU, in fact, we have full programs available online. Most of our instruction is face-to-face. That's really kind of the heart of our campus and what we do. So it's been a major effort to pivot quickly to not only online instruction, but online instruction by remote instructors. It's kind of a double level of difficulty there. And so I couldn't go any further without giving a shout out to the staff in our Center for Instructional Design and Delivery and other instructional designers on the campus who just really hit it hard in mid-March to help all of our faculty ramp up for teaching in an online environment. Again, this was quite a quick pivot. And so in addition to that, just teaching in an online environment, our faculty have also had to consider how to approach more experiential learning activities, things that we don't usually do right in the classroom. So things like science laboratories, clinical placements, student teaching experiences, the arts, all of that faculty have had to consider how they might do that remotely, and they're doing it in very innovative ways. So for example, K through 12 schools are all closed now as well. So our student teachers are working on online curriculum for K through 12 students with the teachers that might have been mentoring them. Our health sciences faculty and nursing faculty are working with their students on remotely demonstrating the critical competencies that the students would need to have before they moved into the healthcare workforce. So just lots of innovation, all under a lot of a time crunch and certainly under the shadow of COVID-19. One other really cool thing I thought was at our School of Social Work, which is always highly innovative. Well, right when this first broke, they did a COVID-19 teach-in where they not only talked about online learning and how that might be different for some of their students, but also the important role of social work in addressing the short and long-term impacts of COVID-19. So as I said, there's just been a ton of innovation by our faculty.
Thanks, Karen. What has been the biggest hurdle in trying to continue normal education during this time?
When you're opening, you said this is a unique situation. I'd say it's been an unprecedented situation, really, in my 30 years in higher education. We don't have anything to compare it to, and it's not just that it's unprecedented in its impact, it's so dynamic. So just if you think over the last month or so, when we were trying to address this, we knew in late 2019 and early 2020 that there was this virus in China, and certainly we're all aware of that. In early March, we were talking about how it might impact our students and the citizens of Maryland. Before spring break, we realized we probably had to take a pause on our face-to-face instruction and move to online instruction for the 2 weeks following spring break, which was in mid-March. Quickly, we had to shift gears to say we're going to finish out our semester completely online, which is a completely different proposition than just a couple weeks online. And then with the governor's stay-at-home order, which of course was issued to keep us all safe and healthy, then we realized we had to teach remotely. We couldn't teach from our offices, which was, as I mentioned before, just really increase in level of difficulty. So that dynamic nature and in terms of impact is really difficult. Things are settling out a little bit now. I'd say we have a pretty good sense of what we need to do now and going into the future, certainly throughout the summer, and we're planning ahead for what fall will look like. There's some question marks out there, certainly, but right now I feel like we're on a little bit firmer ground.
That's a good place to be.
Yeah.
How have the students responded to the adjustment of virtual learning?
Well, I wish they were on campus so I could ask them. I'll tell you that. My person on the street survey that I like to do walking around campus, I'm not able to do right now because nobody's there. But we do plan to do a much pretty structured, collect structured feedback from students kind of as an after action report and get a sense of their experiences. But just what I've been hearing from faculty and from administrators on campus is that students who are used to being here and learning in a face-to-face environment really want to get back. They're not enjoying their online experience because they love to be on campus. That's really the feedback. And then there are other challenges that students face, whether it's connectivity or the technology access. I mean, many of our students love to use our the Gregory Academic Commons and all the technology there. And so we've had to find ways to get them computers and connectivity so that they continue learning. Other students are preoccupied by things like job losses or caring for children, caring for siblings, caring for maybe an ill family member or grieving the loss of a family member. So there's a lot going on for our students besides trying to adjust to online learning, and that could be said of our faculty and staff as well.
Now, I understand some faculty have offered streamlined versions of their courses for use by faculty and students at other universities. What can you tell us about that?
That's true. A good example of that is Dr. Art Lembo in the Department of Geography and Geosciences, and he's taught for many years in our online Geographic Information Systems, or GIS, management program. It's a master's program here on campus. He also authored 2 textbooks related to the area that he teaches in. And so he provided his courses as an open source content to other folks teaching in this area. And I know it's been adopted by at least one campus in Michigan. And I'm not surprised. I don't know if you know this yet, Jason, but Dr. Lembo was recognized this week by ESRI, which is the global market leader in GIS, as their GIS Hero of Spring 2020 for his many contributions. And I think this is really representative of that. Similarly, this is in the area of maybe course sharing, but in terms of collaboration, our schools of education, nursing, social work, and health sciences have been working with other institutions in Maryland of higher education, also with licensing body and other certification type granting bodies, as well as employers, to make sure that we get our students out the door as quickly as possible. I mentioned in particular healthcare workers. For example, our nursing and respiratory therapy students will be finishing all their requirements at the end of April instead of mid-May, so that they can get right out into the workplace. And as you can imagine, those 2 areas in particular are in very high demand right now, given the impacts of COVID-19 on human health.
And they're doing important work.
Absolutely.
Now, you alluded earlier to the fact that faculty members are also leading in the community during this crisis. One example is John Murphy in the Economics and Finance Department, who's taking the lead on a project that's really important to those local healthcare workers you were just talking about. What can you tell us about that?
Right. John reached out across campus to try and collect PPE or personal protective equipment, and he was quickly, many faculty and staff in our College of Health and Human Services started looking through all the cabinets on our campus for that type of equipment. Certainly we have it here in the training of students. We were able to collect a lot of that. But he coordinated that. We used our Wayne Street garage as a drop-off site, and was donated to Peninsula Regional Health System and Atlantic General Hospital. So absolutely our commitment to the community continues. I think also there was outside of my area of academic affairs, but a lot of food was donated from our dining services to a local organization, so that because we're not serving the students, we didn't want that food to go bad either.
Great, that's phenomenal. Mm-hmm. Now, we talked about other faculty using this epidemic as a teaching opportunity in their classes. You mentioned Dr. Dean Rabitza and some of the things that his students are doing that are maybe something that people wouldn't consider a need for during the pandemic, but there is a need for combining learning opportunities with community service. What's his class doing?
Sure. Well, I'm probably not going to surprise any parents out there who have kids around the house and who aren't in school. And especially on a day like yesterday when you couldn't go out and get any exercise and kids can't run around and play with each other under our social distancing strictures. So Dr. Aviza, who always does amazing community-based work, and his students have been developing physical education packets for working at home that are being made available at sites where lunches are available to free and reduced meal school-age children. So they're delivering that. And this is just the kind of work that Dr. Ravitsa is known for. I can't say his name without mentioning that this spring he's being recognized by the University System of Maryland in their Public Service Faculty Excellence Award for this type of work that he does literally around the world. So so that's certainly going on. Also, physical education students will be hopefully right here in PAC 14. They'd like to do that because many students who don't have computers or internet can't take advantage of online workout activities or those types of things. And so they're going to be hopefully on PAC 14 demonstrating workouts that students can do at home.
PAC 14 is always there for the community.
Yeah, that's right.
Oftentimes the unknown is the hardest part of situations like this. And members of the Geography and Geosciences faculty working with the Eastern Shore Regional Geographic Information Systems Cooperative, which is also an SU-affiliated organization, are making county-by-county statistics available in Maryland. What can you tell us about that?
That's right. So the ESRGC, as you mentioned, they're doing this, what's called a dashboard of COVID-19 in Maryland, and it provides all sorts of important key statistics, demographics, county level statistics, and it's updated daily with rates of infection, negative results on tests. It's good to see that there's a pretty hefty number of people who come back not positive on that. And if you're interested in monitoring that, it's all about Maryland. It's, as they say, it's GIS for Maryland. Just go to the esrgc.org website, and it's the first tab under their news over on the right, and the dashboard will pop right up.
It's an important resource. Some of our faculty wear multiple hats too. Robert Figliozzi is an adjunct professor at SU and at the University of Maryland Eastern Shore, and he's also heading a team doing important work at IES Life Sciences in Cambridge, Maryland. What can you tell us about his work?
So Rob certainly is an adjunct here and a doctoral student at UMES. Also, he's an alum of SU. He graduated many years ago, and he's a winner of our Shore Hatchery Entrepreneurship Competition. So he has worked for a long time on the shore, and we're delighted to know that he's continuing to contribute. I believe that his project at IES Life Sciences in Cambridge is working on a more rapid test for COVID-19 that'll indicate whether people are not they're COVID positive when they're pre-symptomatic, and also maybe detecting the level of severity of the infection that they might have, so they can anticipate whether or not they can just provide self-care to themselves, or if they're going to require more significant medical care. And so I think that's terrific work, certainly important work. I'd like to give a shout out to our adjuncts more broadly though. Many of our adjuncts, like Rob, work full-time, or they have other things that take up their time, and they're sharing their talents with us as adjuncts. And they too have had pretty quickly spin up their courses online. And so I was delighted to know that our Center for Instructional Design and Delivery held a special session for them in the evening to try and catch as many of them as they could to help them get their courses online. It's been a heavy lift for everybody.
Yeah, and it's wonderful that they're able to do that they have that flexibility. Now, Karen, obviously this is a very difficult time for the entirety of the SU community. How impressed have you been with how this group has worked together through all of the uncertainty?
Yeah, I think I was on a national call recently among provosts from across the country, and they asked us that question. There's a lot of hard stuff, but what's some of the good stuff? And all of us agreed the good stuff is the level at which people are pulling in the same direction together, and really selflessly committing to our students and their well-being in our community. So I'd say it's really been truly inspiring, and it's exhausting. I mean, the students are exhausted, faculty and staff are exhausted, but we're moving forward. I think my other major emotion related to this is empathy for our graduating seniors and graduating graduate students. If you think back to the end of January when we started our spring term, and how people feel in their senior year or when they're completing a graduate program, the economy was so robust, they were heading out into an incredibly bright future, and all of that has changed dramatically really in just a month here in Maryland. So we're hoping against hope that swings the other way very quickly. We know they're going to do well. We don't know how quickly that will be, but we're here to support them. Our Career Services Office is dedicated to helping them get to where they need to go. And we now know that they have a lot of remote work skills that maybe they didn't have just a few months ago, but we certainly, our heart is with our graduating seniors and graduate students as well. I think the universal sentiment I hear from people when I talk to them about this whole thing is they can't wait to get back on campus. We didn't realize how much we enjoyed the daily interaction with students and our colleagues and our beautiful campus environment. So that I know is a commonality amongst our whole community.
I know we'll all be happy to be back. Karen, thank you for joining us.
My pleasure.
Sure. SU has always been able to rise to the challenge. Today we face a worldwide pandemic that is touching everyone in some way. It's inspiring to see how the university's faculty is stepping up to try to keep things as normal as possible for students and others, and helping out in the community. Thanks again to our guest, Dr. Karen Olmstead, SU Provost and Senior Vice President of Academic Affairs. I'm Jason Rhodes, and this has been Salisbury University on the Air. Thank you for watching.